We are continuing our coverage of a new and deadly infectious disease that broke out in Frankfurt, Germany and Caracas, Venezuela. 2 days ago, the World Health Organization responded by declaring a public health emergency of international concern, a highly unusual step and an indication of its deep worry. Here are the numbers. In Frankfurt and Caracas, the illness has killed an estimated 50 people. There are 400 confirmed or probable cases, with additional reports of suspected but unconfirmed cases. The illness first appeared in Frankfurt about 4 weeks ago. The patients were initially diagnosed with viral encephalitis, a kind of brain infection. Some also were suffering from pneumonia. The first death occurred within days. In Germany, there have been several clusters of cases within families and at workplaces. At least 4 of the dead were healthcare workers who had treated patients infected with the disease. Based on this, German authorities have concluded that the illness is likely spread to person, probably through inhalation of the virus. Our medical reporter Emily Schmidt is at the CDC in Atlanta with more. Emily, what can you tell us?
Jean, CDC officials tell us that most cases are occurring in healthy adults, but there are some cases in children and the elderly. 3 U.S. Air Force service members at Ramstein Air Base have been diagnosed with the disease. Multiple hospitals are involved in Germany, including the U.S. Army's Landstuhl Regional Medical Center. Patients are being placed in respiratory isolation. Many worried well are showing up at emergency departments and clinics. Public health authorities in Germany have been working to isolate the sick and track those who have been exposed. Now, this disease is characterized by fever, cough, confusion, and in many cases, coma, respiratory failure, and death. Initial tests to identify what was causing the outbreak were all negative, but scientists at the Robert Koch Institute discovered a previously unknown virus in the spinal fluid of several of the patients, a new type of para-influenza virus. Para-influenza is a common respiratory virus. It's unrelated to influenza and typically causes colds in adults and croup in kids. It does not normally cause severe illness in otherwise healthy adults.
Thanks, Emily. Venezuela is reacting very differently. Authorities there are denying there is an outbreak, despite reliable reports from people in Caracas of hospitals being swamped by hundreds of suspected encephalitis cases. There are no details or accurate numbers for us to report. However, Colombian health officials have confirmed that 3 people who fled to Bogota from Caracas for medical care do have the virus. How is the rest of the world responding? Well, Australia, China, and South Africa are restricting travel from Germany and Venezuela. Health officials around the world are screening travelers and investigating possible cases. As of now, there are no reported cases in the U.S. As you can imagine, this outbreak is major international news. Numerous media outlets are in round-the-clock coverage mode. Some are calling the outbreak a flu pandemic, and one network has dubbed it the German flu, although experts emphasize that para-influenza and influenza are unrelated, and there has never been a para-influenza pandemic. Scientists have now given this new strain a name, para-influenza Clade X. You are going to be hearing a lot more about it in the days, weeks, and possibly months to come. Caracas is in chaos. On a good day, the government teeters on the brink of being a failed state, and the current outbreak of Clade X could send it over the edge. Although government officials are still denying there is an outbreak, hospitals are overloaded, and reporters on the ground say many sick people cannot get the medical help they need. Cuban doctors have arrived, and several Russian military planes have been spotted at the airport carrying what appear to be medical personnel. Our sources say they have also seen Iranian and Chinese teams disembarking. How dire is this situation? Well, a few hours ago, I spoke with a senior physician from the Venezuelan Health Observatory, a research center at the Central University of Venezuela in Caracas. He asked to remain anonymous, but sent me this statement. He writes, "The government says nothing is happening. It is lying. The hospitals in Caracas are overflowing with incredibly sick patients. The hospitals don't have the isolation capabilities to handle those who are admitted, and many people are being turned away. The hospitals just don't have the capacity to handle them all." So families have to take the sick patients home, and this spreads the disease. He writes, the only thing that will stop this epidemic is massive international intervention, like the response to the Ebola outbreak in West Africa. The U.S. is the richest country in the world, and it has the resources we need. Why won't you help? New information is coming in about the Clade X virus. Let's go right to our medical reporter, Emily Schmidt, for details. Emily?
Gene, anonymous U.S. government sources have told GNN that the genetic sequences of Clade X from the initial Frankfurt case reveal the virus has some genetic elements of the Nipah virus mixed in with the para-influenza genes. Nipah is a rare tropical disease. It's related to para-influenza, but it has a high lethality in humans. Human outbreaks of Nipah are uncommon. The largest outbreaks have happened in Bangladesh between 2001 and 2003, with a 70% death rate. Some experts have speculated on social media that this new virus may not have occurred naturally. They suspect the virus escaped from a laboratory researching a vaccine for Nipah. Others say it is probably occurring naturally, and there may have been some exchange of genetic elements between the viruses. CDC and WHO cannot confirm these reports and say they have no evidence of a laboratory mishap or that the virus is a biological weapon.
GNN has just learned a group calling itself A Brighter Dawn, or ABD, is claiming responsibility for the creation and intentional release of the Clade X virus. In a YouTube video, a spokesman for the group says the goal is to reduce the human population to pre-industrial levels. That, he says, will bring the world back into balance and prevent the destruction of the planet. The spokesman is anonymous. He speaks English, but with what sounds like a British or European accent. Intelligence sources say they were aware of the group, but there were no indications ABD intended to launch any kind of attack. The CDC and WHO are not commenting on the authenticity of ABD's claims that it created the Clade X virus in a laboratory, subsequently unleashing it on the world. The first Clade X outbreak has now been confirmed in the U.S., in the town of South Norwich, Massachusetts. Authorities say the first cases appeared about a week ago in a dorm at East Berkshire College, but they were mistakenly diagnosed as viral meningitis. Now, tests confirm the small college town is instead dealing with Clade X. For more, we go to Emily Schmidt in South Norwich. Emily.
Gene, 12 students have been hospitalized at the Berkshire Regional Medical Center, and we regret to report one has died. A local public health official told me she suspects the outbreak may have started with a student who had recently returned from a semester abroad in Germany. 2 days after he returned, he developed a mild cold and headache for a few days, but did not seek medical attention. The Berkshire County Public Health Officer has issued a quarantine order for the college. Under this order, 800 students, 40 faculty, and 50 support staff may not leave the school grounds for 2 weeks. The students are required to stay in their dormitories. No visitors are allowed on campus, including parents. Prepackaged food is being delivered to the dormitories. Parents of students are loudly objecting. Some are protesting outside the governor's office, demanding the governor overrule the county health officer and lift the quarantine. Gene, I have to tell you, this quarantine does not seem to be very effective. Campus security, supplemented by several local police officers from South Norwich, are attempting to establish a cordoned area, but several people have been seen leaving and entering the dormitories. Law enforcement officers do not appear to know what levels of force are authorized. Mary Witherston's 18-year-old, now quarantined daughter is at that college. I spoke with her earlier by phone.
This is ridiculous. Look, I'm a law-abiding citizen, but you and I have both seen people leaving those dormitories. I've been talking to my daughter on FaceTime. She's not sick. I do not want her there with kids who may be contagious.
Yes.
Give us a brief on that.
So here is the current global information. The colors on this map indicate the severity of the outbreaks by country. Yellow means few cases, red means many cases. Where we have no colors, we have no reports of cases. Clade X has been reported across Europe and in 9 other countries, including the US. There have been more than 5,000 cases that have been reported globally. The outbreaks in Germany and Venezuela, along with the recently confirmed outbreak in Afghanistan, represent the majority of cases, but more than 800 other cases and 60 deaths have been reported outside of these 3 countries.
More troubling news to report from South Norwich, Massachusetts, where there is an outbreak of Clade X. Emily Schmidt is outside the Berkshire Regional Medical Center. Emily.
Jean, patients are refusing to be admitted to the hospital because of the Clade X patients here. In addition, some hospital personnel are being shunned by their neighbors and even family members out of concern that they may spread the disease. There are demands that children of hospital staff be kept out of school, and some hospital personnel are refusing to treat the Clade X patients. Hospital administrators are attempting to reassure the community and staff that everything's under control, but many are not buying it. As of this morning, the hospital census is down 30%, creating an impending financial crisis for the hospital if the situation is not corrected within days.
The CDC is now confirming that 2 people have died in a second outbreak of Clade X in the U.S. The center of this outbreak appears to be in Bethesda, Maryland, just north of Washington, D.C. In addition to the 2 deaths, 49 people are currently hospitalized, 19 in Maryland and 30 in D.C. We are told that all of the ICU beds in D.C. and suburban Maryland are now full, so many of the intensive care cases are being transferred to regional medical centers outside the immediate area, including Johns Hopkins and the University of Maryland in Baltimore and Innova in Northern Virginia. Sources say there are also plans to send some patients to Philadelphia and to Morgantown, West Virginia. Bethesda, by the way, is home to the National Institutes of Health, the nation's premier biomedical research laboratory, and to Walter Reed, the U.S. military's premier hospital. At this point, we are being told that none of the infected patients have links to either facility.
Globally, there have been more than 34,000 cases and 7,000 deaths. There are many more possible cases in other countries according to local and social media, but we are only showing you the cases that have been officially reported to WHO as being confirmed or probable.
Arizona Governor Betsy Johnson is on the line with us. Go ahead, Governor Johnson.
Jean, look, my primary responsibility is to protect the people of Arizona. We have worked very hard during the past several years to make sure we could provide adequate medical care to our residents during a public health crisis. Special facilities are being set up to handle Clade X patients that occur in our state. As you know, the care of these patients requires extraordinary effort. We are efficiently using the medical supplies we do have. I just can't allow patients from other states to use up our limited resources. Arizona needs to reserve our hospitals for our people. If that inconveniences some people, I'm sorry, but I was elected to serve the interests of the people of my state.
Joining us is Dr. Dana Welsh, CEO of St. Elizabeth's Medical Center in Philadelphia. Dr. Welsh, why is your hospital turning away patients being transferred from D.C.?
Jean, we do not have a specialized biocontainment unit, and putting Clade X patients in our hospital threatens our staff and our patients. If a Clade X patient shows up in our emergency department, we will, of course, do our best to care for them, but we cannot and will not voluntarily take patients from other hospitals. It would be irresponsible.
At this hour, there are large-scale protests underway in cities around the world. In some instances, there has been rioting and violent police crackdowns. The cause, the lack of medical care and medications in the face of the Clade X pandemic. The question everywhere, when will there be a vaccine? At least a dozen research labs around the globe are working on experimental vaccines. U.S. officials do not condone the use of untested vaccines, but the situation is so dire that some experts are recommending that these vaccines be used as soon as possible, even without normal clinical trials. This news just in. At least some of the individuals responsible for the Clade X virus are now under arrest. They are members of A Brighter Dawn, or ABD, the group that had claimed responsibility. However, authorities believe that key members of ABD's leadership may still be at large. In addition, Interpol has announced that after a long and exhaustive investigation, the laboratory in Switzerland where the virus was created has been raided and shut down. It was masquerading as a small biotech firm in an industrial park outside Zurich. The group was traced to the location through interviews with scientists who work in related fields. Some of them told law enforcement that they had long suspected that ABD's scientists might be dangerous, but they didn't know what to do about it or where to report their suspicions. Sources say the captured ABD members are telling police there were a total of 6 successful releases of aerosolized Clade X in public places in Bethesda, Frankfurt, Caracas, Hong Kong, Dubai, and Kabul. After extensive interviews with the captured ABD members, however, authorities now believe there were an additional 4 releases of Clade X, which did not result in sustained transmission of the disease, including one near the campus of the CDC in Atlanta. Authorities also say the release of Clade X in Bethesda, Maryland, was a deliberate attempt by ABD to cripple the NIH and thwart attempts to quickly find and develop an effective vaccine or treatment for the deadly virus. Meanwhile, the situation is increasingly bleak. GNN medical reporter Emily Schmidt is in Atlanta, outside the CDC's headquarters. Emily, what can you tell us?
Jean, the outbreak is accelerating. More than 40 countries are reporting outbreaks, and many more are suspected of having cases. Global figures of cases are unreliable, but probably number in excess of 8 million. That's according to the World Health Organization. Deaths attributed to the disease are in the millions as well. WHO and national public health authorities are struggling to find more effective ways to contain the virus. WHO states their own modeling projects more than 20 million cases within 6 to 12 months, with more than 7 million deaths. The under-resourced countries are hit the hardest, but wealthier countries cannot stop the epidemic either. Affected cities around the world are seeing their healthcare systems collapse as they cannot provide care for the infected or for routine patients.
Here is the current U.S. situation. The majority of Clade X cases have been reported in and around the nation's capital and in western Massachusetts, but we now have reported cases across approximately half of the U.S. states and in Puerto Rico, including sizable outbreaks in 38 metropolitan areas. We have gone from approximately 60 cases 3 months ago at the last meeting to nearly 60,000 cases now, including more than 3,500 deaths. The Metro D.C. area alone has 25,000 cases, including 2 members of Congress, several White House officials, and 1 Supreme Court justice. Global markets have plummeted. The Dow Jones is down 60% from its high 5 months ago, and the Fed is now projecting a deep economic recession. Here is the global situation as best we can determine it. Case reporting from many locations is quite unreliable as governments and public health systems have failed. As you can see, Clade X is basically everywhere. As individual country reports are largely unreliable, we are showing case counts by WHO region. We have now more than 8 million probable and confirmed cases and 3 million deaths reported worldwide.
Option 1 prioritizes those with key societal functions in this national crisis, such as government leaders, military, CDC, NIH, healthcare workers, and those making vaccine. Prioritizing healthcare workers and scientists working on the vaccine may increase the overall number of people who can be vaccinated earlier. Prioritizing government officials would ensure continuity of government. Prioritizing critical infrastructure would help ensure the continuing function of essential services. Prioritizing critical infrastructure, however, is not straightforward. There are 16 sectors identified by DHS with tens of millions of people involved. We would have to prioritize within critical infrastructure sectors, which is very difficult. They are all critical.
"20 months into one of the worst pandemics the world's ever known, there's still no vaccine to protect people. Hard figures are impossible to come by, but the World Health Organization estimates that 150 million people have died. That's approximately 2% of the global population. For industrial countries, the death rate's a bit lower, but in many low and middle-income countries, the death rate's much higher. As many as 30% of the seriously ill have died. In the U.S., there have been an estimated 82 million severe cases and 15 million deaths. At least 5 million Clade X deaths happened because adequate medical care wasn't available. No doubt, millions of others will have died prematurely from heart attacks, strokes, cancer, and the like. The U.S., along with the rest of the world, is in its worst economic depression in history. The Dow Jones Industrial Average is down 90%, the GDP down 50%, and unemployment is running at 20%. Unemployment would be higher if not for the dramatic shrinkage of the available workforce due to death and disability. U.S. healthcare and health insurance systems, as we knew them, have collapsed. Health insurance companies ran out of capital and couldn't pay their bills, leaving hospitals without operating funds. In addition, most medical supplies are unavailable. Half the healthcare workforce has died, become disabled, or quit. The remaining healthcare facilities can't cope with all the patients, and consequently, death rates are soaring, both for Clade X patients and for everyone else. It was only by nationalizing the healthcare system that basic medical care is still available. The government now pays for, controls, and rations all medical care. The U.S. is in a constitutional crisis. The president remains in critical condition, and while the vice president is out of intensive care, he remains unable to assume his constitutional duties. Therefore, the Speaker of the House is the acting president. Continuity of government is a major concern. 1/3 of the U.S. Congress is dead or incapacitated, as are 2 members of the Supreme Court and senior members of the administration. Government functioning at the federal, state, and local levels has been brought to a near halt. After the failure of the first vaccine that seemed so promising 15 months ago, along with several other candidates, we now see fresh optimism. The Omega vaccine, which has finally been shown to be safe and effective, is just starting to be deployed as fast as it can be manufactured and distributed. 1/3 of Americans are expected to have access to the vaccine in the next 6 to 8 months. Global vaccine distribution and dispensing, which is an enormous undertaking in the best of circumstances, has been slowed in many locations by riots and looting at vaccination sites. Infectious disease specialists seem to agree that once 80% of the people have been vaccinated, the epidemic should be brought under control with an ultimate 20 million deaths in the U.S. These same infectious disease specialists say we're lucky because the virus is similar in some ways to common para-influenza viruses, and only 1 dose of vaccine is needed. The situation in most of the rest of the world is much worse. Massive loss of life, economic collapse, famine, and civil unrest. There's been a mass exodus from cities, adding to the spread of the disease and making vaccination programs even more difficult. The nagging question: what would have happened if we had a vaccine many months earlier? If the first vaccine had worked and started to be deployed at 6 months into the pandemic, the U.S. death toll could have been reduced from an anticipated 20 million to 6 million, with similar reductions in economic and societal consequences. On the other hand, what if years go by without a vaccine? Then, experts tell us that we could eventually see 30 to 40 million deaths in the U.S. and more than 900 million around the world, 12% of the global population. Eventually, once almost everyone's been exposed, the disease will either burn itself out or become endemic, like the dreaded childhood diseases of prior centuries. What the world will look like when it's done is still very uncertain.